Good morning, everyone. My name is Betty. My student ID is S335300. My first slide is on the presentation of assertive communication in the health and social care sector. My second slide, introduction. In addition, I have the introduction slides where I have 10 subheadings on the topic assertive communication in health and social care. Assertive communication enables healthcare professionals to communicate clearly, respectfully, and confidentiality while maintaining professional relationships. Therefore, healthcare professionals must adapt communication methods to meet the needs of diverse communication users, including those with communication difficulties and cultural differences or emotional distress. Furthermore, assertive communication facilitates effective collaboration among multidisciplinary teams by ensuring accurate and respectful information exchange. My slide 3 is on definitions and characteristics. Definition of what assertive communication is. This involves expressing views honestly while respecting the rights and opinions of others. In addition, assertive communication is a balanced communication style between passive and aggressive communication. Above all, it allows professionals to communicate openly through mutual respect. I'll mention a few characteristics in assertive communication that is used in a consultation between the professional and service user. Active listening, empathy, appropriate eye contact, calm and confident tone of voice, respect for self and others. In relation to assertive communication in health and social care sector, this promotes mutual respect among professionals, creating an environment where team members can contribute effectively to positive patient outcomes. My slide 4 is on strengths and limitations in assertive communication. Notably, the strengths and limitations of assertive communication in the health and social care settings. In this slide, I'll mention a few examples of the strengths and limitations. One of the strengths, enhance patient safety. Here, assertive communication encourages professionals to raise concerns promptly regarding risks like medication errors, safeguarding issues, and clinical decisions. The second strength, the building of professional relationships between the professional and service user. Here they clearly have boundaries based on trust and respect. For example, a nurse clearly explains treatment options and encourages patients' cooperation, asking them to ask questions on their medical diagnosis. In addition, the limitation in assertive communication, such as risk misinterpretation. Here, confidence may occasionally be misunderstood as aggressive if the tone and body language are inappropriate. The professional facial expression, a frown instead of a smile, and a loud tone of voice instead of a gentle, empathetic voice. The next point is on emotional risk. A patient is told by a professional they have stage 4 colon cancer and become highly distressed. They do not respond well to the assertive communication. The patient needs the professional to be empathetic and patient for them to come to terms with their medical condition. For example, a patient experiencing distress may be misunderstood for aggressive behavior. Slide 5. Diverse communication is the practice tailoring messages, languages, and communication styles to effectively connect with people from different cultural backgrounds and learning disabilities. For example, a person with hearing loss may require sign language or written information. There are 4 main types of communication in the health and social care settings. The first one is verbal communication, second, non-verbal communication, the third, visual communication, and the fourth, written communication. In this slide, I will discuss 2 types of communication. Verbal communication. This involves strong, confident speaking voice and is usually conducted in consultations or assessments. Healthcare professionals should use simple language and avoid medical jargon. Active listening is important to ensure understanding and build rapport with the service user. The next one is visual communication. Here we use pictures, symbols, diagrams, and charts. This method is useful for individuals with learning disabilities such as autism or speech difficulties or language barriers. These visual aids improve understanding and support informed decision making. Slide 6. Application in practice. Slide 6. Application in practice. Moreover, a nurse respectfully challenges a medical dosage recommended by the doctor that may harm the patient. In this instance, the nurse has used assertive communication to improve the patient's safety. Another example. A support worker notices signs of neglect in an elderly service user. Here, they will ensure that they contact safeguarding team for timely intervention. All of these examples have used assertive communication to report concerns to the safeguarding team, get timely interventions. Importantly, the outcome will improve patient safety, better care coordination, and patient trust. My 7th slide is on adapting assertive communication, particularly adapting older adults with learning disabilities. The professionals should use simple language in a slow tone for them to understand. In fact, the professionals be aware of individuals from cultural backgrounds and demonstrate cultural sensitivity. Indeed, to avoid assumptions that all individuals can speak the English language. In this instance, they'll need an interpreter. For example, furthermore, the Equality and Diversity Act must be used in person-centered care to all individuals at hand. Slide 8, team collaboration. What is team collaboration? This involves professionals working together to provide a safe environment and person-centered care. For instance, assertive communication in a team supports the improved health outcomes, accurate information sharing, patient trust, clear handovers, reduced errors, multiple disciplinary team, and professional fulfillment. This allows a multidisciplinary team to demonstrate communication channels through verbal and nonverbal communication, sharing information to understand the individual's needs and development through person-centered care plans. For example, during discharge planning, a patient receives support and service after leaving the hospital. Slide 9, improvement strategies. Slide 9, improvement strategies. I'll discuss the improved strategies. 1. Mandatory training and development. Professionals must know how to communicate with the patients using nonverbal cues in the health and social care sector. The next one is emotional intelligence. The professional should recognize emotional stress and be sensitive to the service user's needs. Another point, constructive feedback skills from colleagues, supervisors, and service users. It all reflects that communication training enhances teamwork, reduces misunderstandings, and improves problem solving among the professionals. Slide 10, reflection and conclusion. Reflection. This analysis has demonstrated that assertive communication is a fundamental skill within health and social care. I have learned that effective communication is not simply about speaking confidently. This also involves respecting others, active listening, promoting team and personal centered care. Finally, assertive communication contributes to the person-centered care, teamwork, and professional relationships to gain a successful patient outcome in a health and social care environment. Slide 11. This has my Harvard reference list. Thank you so much.